Hey, y'all know me, I'm Dr. B. This is The Buzz on Roseola. Today we're going to talk about roseola. It's another one of those diseases with multiple names, so let's go over those to clarify things. The official full name of roseola is Roseola infantum, but usually we just call it roseola. We just talked about fifth disease last week. Well, roseola is also called sixth disease, as it was the sixth on an old list of common rashes. Another name you might hear is exanthema subitum, which is Latin for sudden rash. It's also sometimes called 3-day fever, and I'll bet you can guess why that is, but we'll get to that in just a minute. And finally, here in the South, you may hear some people, some old timers say baby measles, which is super confusing and sounds pretty scary because measles can be a serious problem. But I just mentioned this to let you know that roseola is not measles, is not related to measles, and it's not as serious as measles can be. Roseola is caused by the human herpes virus, numbers 6 and 7, usually herpes virus 6. Kids usually get this from about 6 months to 3 years. Just about every kid does get this by 3 years. It's passed through saliva. It's very contagious, and it goes through daycares like wildfire. Don't get mad at your daycare if your kid gets this at daycare, because even the cleanest daycares will have problems controlling this because it's so contagious. The way roseola presents is very predictable. It always follows the same pattern. You start with a very high fever, maybe up to 104 to 105. This comes on very suddenly out of nowhere, and usually there aren't any other symptoms. In fact, the kids often look fine despite the high fever. However, the fever shoots up so high and so fast that some kids, especially younger kids, can have febrile seizures from this, and that's very scary when your child has a seizure, but this doesn't cause any lasting harm. Febrile seizures, however, are not common, by the way, so not something to really get too concerned about. The fever can last for several days. Often it lasts about 3 days, which is where the name 3-day fever came from. The fever suddenly goes away, and at just about the same time, very important that the timing, usually the fever goes away and that rash is starting to come on. A pink rose-colored rash starts showing up on the torso, mostly on the front and the back of the chest. And you can see that this is slightly raised, and it looks like a bunch of distinct, slightly raised pink dots. But there's so many of them that they do become confluent, and you'll have areas where it's really just a raised wide area of pink. They're all pretty similar, and they're blanching, which means when you push on them, they disappear, and then they come right back when you let go of the skin. Often this rash stays just on the torso, but it can spread up to the neck and maybe the nearer part of the limbs. You can see it creeping up on the child's chin in this picture. It can go to the limbs, but usually it's not going to be like all the way down to the hands or the feet. It may be a little bit itchy, but not always. Once the rash shows up, the fever should not come back. That's the typical presentation. Fever goes away, rash shows up, and then the fever should not come back after that. In a couple days, the rash will go away, and that's about it. The kid's unlikely to get this again if they have a normal immune system. And I know it's a pretty stupid disease because all it does is cause fever and rash. It doesn't seem to have much of a point, but there it is. We do have to differentiate this disease from other things like scarlet fever, measles, and fifth disease. Your doctor shouldn't really have a lot of trouble with that distinction. Fifth disease, for example, we talked about that last week. Usually the cheeks are extremely red and the upper part of the arms are red. There's not much fever. Scarlet fever, you should have a sore throat because that's strep throat with a fever, as you saw in, I think, episode 2 of this series. Measles is very rare. Rubella is also rare. Kids with measles typically have cold symptoms as well and pink eye, and it starts at the hairline and goes down. Rubella usually begins on the face, then goes down. Not much of a fever with that. Chicken pox, this is rare, but we do occasionally see it, and they'll have pustules, things that look like pimples and ruptured pustules instead of the pink spots that you'll see with roseola. And drug rash, what you're usually looking for there is a history of using a medication, and they shouldn't have any fever with the drug rash. So the classic sequence of fever and rash that's so typical, if we get that history, We just diagnose it clinically, and no labs are necessary. There are some blood tests that can look for roseola or for the antibodies to roseola, but I've never seen anyone actually order those. As far as treatment, the treatment is what we call supportive, making sure the child drinks plenty of fluids, keeping that fever under control, especially if you're concerned about febrile seizure, if the child has a history of febrile seizures, or if they've already had one, you don't want them to have another one right away. So you're going to want to keep that fever under control. But there's no specific therapy other than that. Once kids are fever free for 24 hours, and they're feeling better, then they can go back to school. Well, that's it for roseola, aka exanthema subitum, aka sixth disease, aka 3-day fever, aka baby measles, but please don't use that term. But if you hear it, that's what we're talking about. I hope you enjoyed this video. If you liked it, please share and comment below. And we'll see you next time on The Buzz with me, Dr. B. Thanks for watching.